Before replacing a dislodged gastrostomy tube, make sure that it's been there for several weeks. 4 to 6 is a good range. Some sources say less than that, but I'm comfortable in that 4 to 6 week range. Inflate the balloon according to the manufacturer's guidelines and check that it is intact. Once you apply some surgical lubricant, you're going to try to gently advance the tube, trying to find the existing tract. And you want to do this with some gentle pressure and redirection as needed. Ultimately, we were not successful with this tube, so we had to go down a couple sizes, and it's the same approach. Gentle pressure, redirect until you find the tract, and here we're successful. You can hub it and then inflate the balloon. Then you gently pull back on the tube until you know that that balloon is right up against the stomach and abdominal wall. Slide the bolster down to the skin. You want to easily be able to rotate the tube. Confirm placement by injecting a little bit of water-soluble contrast and then immediately getting an x-ray of the abdomen so you can see the contrast going into the stomach, not the peritoneum.